When a patient presents with acute pain and has a risk factor for opiate use disorder, the goal is to avoid opiate use. Of course, if the patient fractured their hip or their femur or their shoulder, you may consider giving an opiate. But being a regional anesthesiologist, I would consider doing a nerve block. That's usually my first go-to measure, and it usually works quite well. Of course, it depends on the pathology. So if the acute pain is related to a headache, I would consider occipital nerve block. If it's neck pain, I would consider trigger points or ultrasound guided brachial plexus if there's a radicular component, or medial branch blocks. If it's related to rib fractures, I would do intercostal nerve blocks or paravertebral nerve blocks for physicians who are not so comfortable with those procedures because of the risk of pneumothorax, but they do have an ultrasound and experience with interventions such as an emergency room physician, for example. I would consider doing a rectus spinous plane block. So there's a lot of ways to treat acute pain in patients with at risk for opiate use disorders.